Hello, and welcome back to the Jefferson Enterprise Preoperative Education Series for Bariatric Surgery. This presentation is the sixth in the series and will detail what you can expect after your surgery is complete. This video is specifically about preventing complications after surgery. With any surgery, there is the potential for complications, and bariatric surgery is no different. However, there are things that can be done to prevent complications. This is a very important part of the recovery process and involves the patient and the bariatric surgery team working together. While you're in the hospital, the staff will be monitoring you carefully for any signs of complications. Complications are rare, and they are treatable when they do happen. The most common complications that you can help prevent are dehydration, blood clots, pneumonia, and infection. Preventing dehydration starts before surgery and continues during the intraoperative phase and postoperative phase. The day before surgery, when you are on a clear liquid diet, drinking enough fluid is imperative so that when you arrive for surgery, you are well hydrated. During surgery and after, you will be maintained on IV fluids to continue to keep you hydrated when you cannot yet drink. Once you start your stage 1 bariatric diet, you play the most important part in preventing dehydration. You will start sipping clear liquids, and you will need to sip all day long. As a reminder from the video on starting the stage 1 diet, you will start sipping slowly to work your way up to at least 3 to 4 ounces per hour before you leave the hospital. Ultimately, at home, your goal is to drink 4 to 6 ounces per hour. This will ensure you drink 64 ounces per day. You may experience some discomfort when starting to sip. Remember that you have a freshly cut stomach, and so some discomfort is expected. Ways that you can ensure success are to set alarms to remind yourself to drink and to keep track of how much you are drinking. Try different types of clear liquids in different temperatures to see what works for you. And remember, you are not allowed to have caffeine in this stage because it can contribute to dehydration. If you are having some problems with drinking, please be sure to let the staff know. It is also important that you understand the signs and symptoms of dehydration. If you experience these at home, please get in contact with your surgeon's office right away. The signs and symptoms are progressive weakness and profound fatigue, muscle cramps, dizziness upon standing, nausea or vomiting or dry heaves or retching, low urine output and urine that is very dark or concentrated, and headaches. Preventing blood clots starts when you receive a blood thinner injection prior to your surgery. You also will be wearing compression boots, both during your surgery and after. These devices inflate with air to prevent blood from pooling in your legs when you are immobile. One of the most important things you will do to prevent blood clots is to get up out of bed and walk. You can start walking as soon as you are awake enough after surgery. You will be asked to walk within 4 hours after your arrival to your room. You are expected to walk frequently after surgery. This means doing laps in the hallway, not just walking around in your room. If you feel you need assistance to do this, please let the staff know so you can get the help you need. If you use assistive equipment at home to help you walk, such as a cane or walker, please bring this with you to the hospital and let the staff know that you need to use it to walk. It cannot be stressed enough how important walking is to your recovery. Yes, you may feel very tired after surgery, but you will still need to walk. Patients that walk frequently after surgery feel better sooner. If you are sitting for a prolonged period of time, such as when you're eating, please make sure your compression boots are back on and that you move your legs around. You will also continue to receive blood thinner injections during your hospital stay. Depending on your specific circumstances, you may or may not be discharged with a prescription for a blood thinner to take for a certain number of days. If this is the case, the staff will teach you how to give yourself the injection, how often you will do it, and for how long. If you have questions about this after discharge, please get in touch with your surgeon's office right away. It is important for you to know the signs and symptoms of a blood clot. This usually occurs as new onset symptoms in the leg that are usually one-sided. You can also get blood clots in your arms. The signs and symptoms are pain and tenderness, swelling, redness, and warmth. Blood clots are dangerous because they can travel to the lungs, where they can cause shortness of breath, trouble breathing, heart beating too fast, and chest pain. If you experience any of these at home, please contact your surgeon's office right away. When you arrive to your hospital room from the recovery unit, you will be given an incentive spirometer and shown how to use it. The picture here on the screen shows what a typical incentive spirometer looks like. These breathing exercises force you to open up your lungs. Do 10 breaths every hour. You can do the breaths all in a row, or you can do one breath every 6 minutes. You should also cough and deep breathe every 30 minutes. You can use a pillow or folded blankets to provide counter pressure on your belly to help ease any pain or discomfort you may feel with coughing and deep breathing. And once again, frequent walking is so important because it also helps prevent pneumonia. You should aim to continue to use your incentive spirometer and do coughing and deep breathing exercises for 1 to 2 weeks after surgery. The signs and symptoms of pneumonia that you should know are fever, chills, body aches, congested productive cough, shortness of breath, and headache. Please contact your surgeon's office right away if you experience any of these signs and symptoms when you are at home. Infection prevention starts before surgery. As mentioned in the first video in this series, you may or may not be asked to do a special wash the night before surgery. Please follow the specific instructions given to you by your surgeon's office. When you're in the hospital and the nurses are getting you ready for surgery, you will have your skin cleaned with cloths that contain chlorhexidine, which is an antibacterial solution, and you will receive antibiotics in your IV. After surgery, there are simple measures that you can take to ensure that your surgical wounds do not become infected. You should wash your hands frequently and before you are going to touch your belly. You should keep the incisions clean and dry and avoid touching them directly. When you shower, do not scrub directly over the incisions. Shower with mild soap and warm water. You can allow the soap and water to run over your incisions. When finished showering, pat your belly gently with a towel to dry the skin. Do not apply any lotions, creams, or ointments to your incisions, and do not cover them with a bandage unless specifically instructed to do so. Avoid contact with people that are ill and limit visitors in your home while you are healing. Another good practice is to disinfect commonly used surfaces daily. Signs and symptoms of infection include increased pain, tenderness, redness, swelling, and/or warmth at the incision sites, pus draining from the incision sites, and fever, chills, body aches, and fatigue. Please notify your surgeon's office if you experience any of these signs or symptoms. Thank you for watching. Please be sure to continue on with the next video in the preoperative education series, which describes the discharge process and your recovery at home. Thank you.